for the introduction. Is it okay if I don't hold the mic? Is it okay to you? Thank you very much. Good morning, and thank you for this opportunity. My name is Kim Yuan from South Korea. I'm a family medicine doctor and also a person living with obesity. I want to talk about current situation in South Korea and the challenge we face and why we have to hear the voice of lived experience. South Korean government collects obesity-related data through National Health and Nutritional Survey and the National Health Checkup System. These provides continuous nationwide information on obesity and related risk factors. In 2018, the first comprehensive obesity management plan was launched. For the first time, obesity was formally placed on the national policy agenda. Some progress was actually followed, including mandatory placement of dedicated obesity management professionals in every local public health center and the expansion of community-based programs, school-based programs. These were very important steps forward. Since last 2024, several bills were referred as Obesity Act have been made by major political parties. This reflects a growing recognition that obesity needs to be addressed not only as an individual issue, but also as a matter of national policies. Korea has also implemented several laws and regulations related to food. Nutritional labeling on processed food is mandatory and sugar reduction campaigns are promoted. Since 2010, under Special Act on Children's Food Safety Management, schools are not allowed to say high-calorie, low-nutrient foods in cafeterias or vending machines, and also advertising of unhealthy foods to children during TV program or online content is restricted. However, gaps remain. Korea doesn't have sugar tax. Also, regulation of ultra-processed food is kind of weak. And while direct advertising is restricted, indirect advertising through digital media such as YouTube, Instagram remain unregulated. Also, maybe you've heard about it, mukbang. There's a popular content in Korea, which is like eating an enormous food which is unhealthy, is very popular, especially with children. So it's promoting an unhealthy consumption and lifestyle, but it isn't touched by any policies. So I feel the groundwork is ready, but we need a little bit of care of details. And at this assembly, I actually heard a lot of discussion of NCDs and also obesity, but it was usually obesity prevention. Of course, prevention is very important, but I want to make a I want to make the point very clear. The most perfect prevention system doesn't cure obesity. Prevention does not magically lead to obesity management for even a person who lives with obesity right now. According to World Obesity Federation, 1 billion people is living with obesity, and also in 2035, 4 billion, almost a half, will be living with obesity or overweight. And if we just focus on prevention, we're leaving them away. So it's a very important turning point, and I want to ask, please do not abandon us. Yeah, do not abandon 1 billion people who already is living with obesity. Also, South Korea is similar. We don't have World Obesity Day, we have Obesity Prevention Day. So I have to go and speak up to change that. And also the bills actually was recently was in the national health program to be neglected again. So I want to make the change when I go back to South Korea. And also, especially I was so surprised there was not that much talk about obesity care and medication, especially when there is a solution right now. And maybe it's too far expensive. So I think it would be very important to make the medication accessible. And I want to tell my story to get the message stronger. Actually, when I was in my lowest weight, I was 70 kilograms. I actually just lose weight only by exercising. I didn't have calorie restrictions, and I lose like 30 kilograms. And even then, I couldn't attend the public obesity management program because it was too straining to my knees, my ankles, my wrists. Even though I was a licensed doctor, but I was a licensed certified personal trainer. I was so into training. I was training a lot. I was doing marathon, but I couldn't attend the public program because the public program wasn't meant to be obesity management. It's just health promotion. So I think it's very important that lived experience is included in the policy, research, and also the training of the professionals. Actually, I am quite privileged because I am a doctor. I was able to attend the training of the professional local public system since 2022, but I know there's a lot of countries, a lot of activists, they are voicing up, but they're not being heard. So